Hey guys, it's Kelby here, and I know one of the biggest fears that any of us live with is the fear of the unknown of what something's going to cost. You know, in vacations, when you're planning for vacations, you typically want to ask a few things like, well, how much is the hotel, how much is the condo, how much is the house, how much food is going to cost, how much gas, how long is it going to take us, how many times we're going to stop, how many snacks we're going to have to take, and all these building up costs. Well, guess what? If you're experiencing this going into retirement and beyond, when it comes to your healthcare costs, most all of us worry about the same thing, and a lot of times we can eliminate all that fear by really understanding a few simple principles I'm going to be covering in just a moment in this video. I'll be right back, and we're going to eliminate the fear that you have to have towards healthcare costs on Medicare and Medicare health plans. Talk to you in a moment. Hey guys, my name is Kelby Hightower with Medicare Hub, and if you guys have not liked, subscribe, or share our channel with anyone, I would like you to take a second to subscribe, also like, and then share it with a friend or family that's trying to get questions about Medicare, Medicare health plans, and then also we'd like to talk about life in general and how it affects you as you age into Medicare and beyond. So 65 years of age and beyond is really where we focus, but also obviously we're an insurance agency that specializes in Medicare health plans. If you need help and answers to your questions when it comes to your Medicare health plan options, reach out to us. We'd love to be able to help you, can answer the questions. We have a guide mindset towards helping you identify your problem and then guiding you towards a simple solution and making that simple. We like to say Medicare is extremely confusing. We're here to make your life easy by making Medicare simple. And I'm going to dive into one of the biggest things that we hear often is just, and really experience. When we sit down with somebody who experienced this, we're talking to people who are experiencing this, and that is the fear of cost when it comes to healthcare, but also the fear of rising healthcare costs. And what does it look like for me in the future? And what if this happens? What if this happens? And I always said it when people are asking a lot of what if questions, it's usually the fear behind what is going on, and we're going to eliminate some of those fears by understanding just the basics of Medicare. So one, if you're going into Medicare or you're on Medicare now and you have a red, white, and blue card that says Part A, Part B on it, one of the greatest things to realize is that really creates a key or an open door opportunity for you to enroll into a health plan, in any health plan that you choose, whether it be a Medicare Advantage plan that's like an HMO or PPO, or a Medicare supplement like a Plan G or a Plan N, and then like a drug plan that's going to cover the medication if you choose a supplement. Any of those options, if you choose anything, it's going to be much greater than just original Medicare. I often say original Medicare has this huge question mark. If you go in the hospital, Medicare Part A has a deductible. After so many days, you begin to have to pay a per day cost up until so many days, and then 100% of the cost is your responsibility. So Part A, hospitalization on Medicare, has a big question mark. What is it going to really cost me if I go into the hospital? Well, on any Medicare Advantage or Medicare supplement cost, it's going to reduce that down, typically no greater than a cost of about $4,000 or $5,000, regardless of what happens to you with your health throughout the entire year. The most you're going to pay out in a given year for any type of health plan is probably going to be about $3,000 to $6,000, but normally $4,000 to $5,000 is the max that anybody's going to pay out in premium, copay costs, or anything. We're on original Medicare. Guess what? If you owe it, you pay it. So you're going to have some risk exposure here. So eliminating the fear, one, is realizing if I have Medicare Part A and Part B, if I go to the hospital with Part A, I could have this big question mark of unknown costs. I am going to make a decision to choose some form of health plan to eliminate the risk of this high cost potential. Second thing is Part B of Medicare, the medical portion, anything really outside of the hospital that we experience, going to primary care, specialists, diagnostics, outpatient surgeries, therapies, all these moving parts of things that fall under Part B. And I want to simplify that down because Part B has a deductible and it has a 20% billable rate. Well, 20% of what? And it's going to be 20% of the billable rate. Well, what's the billable rate? You don't know, I don't know. We all experience this when we've gone to the doctor's office with major medical insurance before and we're like, what's it going to cost? And they say, well, your copay is $10. Well, what else am I going to have to pay? You don't know until what? You get the bill and then your 20% or the deductible plus 20%. There's these big, huge gaps in this care called Medicare as well, just like there is in major medical. So what do? If we have Medicare A and B, it's a key effect that unlocks the door that allows you to enroll into a Medicare Advantage or Medicare supplement. Now, which plan do you choose? That's all stems from the basis of what is your needs, who are your doctors, your specialists, your medications, your plan needs, and all these details that we usually collect information, put it into a platform, identify, educating that person really how Medicare Part A and Part B work and the risk of cost, and then what style or type of plan based on how they live, if they're going to be traveling, if they're chronically ill, if they're not chronically ill, what risk of exposure are they willing to take? Do they mind networks? Do they not like networks? Most people that have come out of major medical had networks. They don't care, so they can choose a Medicare Advantage or Medicare supplement. There's all these questions that we like to ask and get answers for, and we pull this information into a dashboard, and then we're able to guide that person towards what's best for them based on their needs. It has nothing to do with what our concern is, what we feel like is best. It really has what comes down to what you feel is best for you based on the questions we ask, and then identify what plans are going to be best. If you're in this situation and you're confused and you're like, this fear of cost of healthcare is really gripping me and I can't decide if I'm going to retire, or if I can retire, do I need to continue to work? All these moving parts, you need to eliminate that fear by knowing your true cost of what your health insurance is going to cost you. And the only way to do that is either A, you understand it yourself, and most people will never understand Medicare, it's extremely confusing, or you put your trust in someone like us that can guide you through solving that problem for you, identifying the true cost so you can make an informed decision for yourself and then be guided into the health plan that's best for you to be able to start your retirement. Or if you're after 65 and you're still kind of freaked out about the cost of things, you need to have somebody that's a licensed professional that's been doing this for years and can guide you through making decisions that's best for you. So guys, do that. If you have not had the opportunity to talk to us or talk to someone that you trust, I would encourage you guys to be able to call in, schedule a time, allow us to be able to educate and walk you through answering and getting you to a place of eliminating the fear of rising costs. I'll be back in just a moment to go over the next point of this video, and then we'll answer some additional questions you may have about fear and cost and things like that as well. I'll see you on the other side and see you in a moment. All right, guys, I'm back, and I want to cover just one thing that often comes up, and that's really planning for the gaps when it comes to somebody that's been working. Maybe you're older than 65 and you're looking to plan for the gaps. And what are the gaps? That's a great question. I'm glad you asked it, and I'm going to be able to go over what the gaps are. And the gaps are really about things that we find important, like our dental health, vision, hearing. Dental, hearing, and vision is a big one. Hey, I want to be able to continue to go to the gym, and I've heard my friend talk about free gym memberships with their plan. What is that about? You may have all these moving questions, or you're looking at health plan options and you're looking at things like Medicare Advantage, but you've heard your friends say, I went to the hospital for 2 days and I had $500 or $600 worth of copay, and you're like, I don't want to have copay. How can I not have copay? And there are options, one, for standalone dental plans, hearing, vision, additional insurance you can purchase and own and control the outcome. If you do have to have needs for dental, hearing, and vision, you can own an insurance policy for that. You can also own and enroll into a Medicare Advantage plan that covers the large portion of that, or add an additional policy. And typically those policies are going to be less than $30 a month and going to have great comprehensive coverage for all your needs. Now, what happens if I go into a hospitalization situation? I have copays left over. Is there a way to insure and cover that gap if I'm on a Medicare Advantage plan like an HMO or PPO plan? Because they are going to have copay costs typically associated with staying in the hospital up to 5 to 6 days. Now beyond that, the health plans cover it, but what about those 5 or 6 days and the copay cost is maybe $300 a day and that's $1,500 a cost? You don't want to take out of the bank. How do you insure against that risk? And that's where like hospital indemnities and or like cancer riders, a lot of times if somebody's diagnosed with cancer on Medicare Advantage plans and have to have chemo, one of the highest two costs involved in Medicare Advantage plans deal with hospitalization and then chemo. You can actually, for a few dollars a month, no more typically than $60 a month or less, you can actually own an insurance policy that covers the cost, the majority if not all of the costs associated with hospitalization and then cancer. Guys, that is very important to understand. How do I fill the gaps if I choose to enroll into a Medicare Advantage plan? And then a Medicare supplement, you typically are paying the premium to cover the gaps for you and to have very small cost deductible or maybe a very small copay cost if you choose like a plan in. But Medicare supplements work in reverse. Medicare Advantage plans have zero premium. You have some exposure, but you can cover what, since gaps in care and coverage and cost. Medicare supplements, you have a premium to cover the gaps in the coinsurance and the risk. So it depends on what type of plan you want. Again, reach out to us. We'd love to be able to set up a time. If you have additional questions, guys, follow us. Subscribe, like, and share our videos. We have a huge amount of content about subject matter about this, and also just talking about life and how to be prepared and not fearing and creating anxiety for yourself and all these moving parts of living a life when you come 65 years of age and older. Guys, until next time, I'll talk to you soon, and I'll see you on the other side.